Hello and welcome. I'm Mariam, co-founder and CEO of Babbly. Today, I'm bringing you another episode of interviews where I speak to experts from the world of child development and ask them questions that I struggle to find straightforward answers to as a first-time parent. Thank you, Dr. Travis. I'm really excited to speak to you. I got to know about your work through the collaboration that we've been talking about at Babbly, and was fascinated by your research. Maybe I'll start by formally introducing you, and then I would love to hear from yourself. So for those of you who don't know, Dr. Katherine Travis is an assistant professor in the Division of Developmental-Behavioral Pediatrics at Stanford University. Her research uses human neuroimaging and behavioral measures to examine the neural basis of early language learning in infants and young children. The goal of her research is to develop therapies and interventions to help promote language learning outcomes in children at risk for learning disabilities. This subject is very close to my heart, but I would love to know what got you into this field. And then if you can tell us about the work you're doing at Stanford Children's Hospital.
Sure. So, I initially became very interested as a undergraduate in neuroscience research initially, and kind of what piqued my interest in it was the notion of neuroplasticity, the idea that the brain is adaptable and shaped by our environments, that, we can actually kind of tune our brains and change them as a result of what we're exposed to early on in life and throughout our lives, really. And that's actually very much at the core of what I'm very much interested in studying at Stanford. So a lot of what my research focuses on now currently is trying to understand how a baby's early environment shapes their brain development and also their behaviors, particularly their abilities for language. So just briefly operationalizing environment a little bit. Right now, a lot of my research focuses on experiences preterm babies have. So their environment looks very different than a typically developing infant. So they're developing in the NICU, or the neonatal intensive care unit, which is a vastly different environment auditorily, sensorially, than the typical womb environment. So I'm interested in kind of understanding how those experiences may impact early brain development and later language.
Really interesting. This idea of neuroplasticity and the fact that, the 80% of the brain grows in size by age 3 is something that we hear, and sometimes when I share it, people are, find it kind of surprising and unbelievable. Can you expand on it? Like, what does it mean exactly, and why those first 3 years are so important?
Right. So you're absolutely right. There's an extreme amount of rapid growth within the first 0 to 3 years of life. So the brain is just growing in size. It's close to adult size already by 3 years of age, but there's still a lot of connections that are being formed and that are being refined throughout the lifespan. So a lot of what's happening in the brain is that we're actually kind of overshooting. We're making a lot of additional connections, a lot of extra additional synapses. And as we start to become more refined and skilled, those behaviors start to become more tuned up. So you can think about a lot of the connections within the brain as the major highways or pathways of the brain. And a lot of those are already there upon birth, but they're not necessarily, they're more like 1-lane or 2-lane highways, and they become larger, more massive freeways like those connecting San Diego and Los Angeles. They're getting bigger and wider as the networks become larger and more engaged. So there's a lot of growth that still goes on past that age.
And that's the interesting part. Like, obviously learning doesn't stop at age 3, but what are some of the examples of things that really expand in those first 3 years? Let's say, if there was one area that you would say it will be fairly established by age 3, and the expansion or the development kind of plateaus after that. Or is there any?
I think it's an open question. I think there's a lot of development that's still very much going on. A lot of what we know is still a very long and protracted process is the process of myelination. So axonal pathways are pathways that connect different regions of the brain, and they're you can think of axons like the wires of the brain, and then those wires are ensheathed with another type of cell, myelin, and that myelination process rapidly grows within 0 to 3, but that's not over by 3 by any means, and a lot of that process is actually induced by ongoing activity, and different parts of the brain continue that process at different rates. So parts of the brain do that very quickly, like the visual parts of the brain. So just like babies, their visual system comes on very rapidly. Initially when they're born, they can't see very well, the acuity is very poor, but already by year 1 of age and before that, they already have adult-like acuity. So it makes sense that those areas, develop very rapidly. Whereas frontal parts of the brain, which, are much more involved in what we think of cognitive processes, they're myelinating well into our 30s, our 20s and 30s age of life. So that process is still going on. It's maybe not as rapid and as robust as the visual cortices, but that's still very much going on. And we're forming, those pathways are still connecting up. They're still refining one another. The other cellular processes are still very much going on throughout the lifespan.
And where does language fit in that? Is it as rapid as visual development, or?
No, it's much more protracted, obviously. It's just as you think about it, very early on, babies are already capable of hearing in the womb. So around 24 to 28 weeks, babies start to detect sounds, right? And those abilities are likely important for language, but that's by no means any sort of sophisticated ability for language. But then very rapidly, they start to detect mother's speech from a stranger's voice. Are they comprehending her voice at birth? By no means, not at all, but they can recognize it. And so that process becomes very much more protracted, but already by 1 year of age, babies are comprehending tens of words. They're starting to say them. So, and then those skills become, language kind of builds upon itself, right? And then we start to build into other abilities for reading and writing, for example. So you can think of language as this big umbrella kind of behavior for all these other abilities.
Very cool. Let's come back to preterm babies, which I know is the focus of your research. Can you tell us a little bit how different is the brain size or structure? Like, what are some of the things that you have seen in your work, especially with MRIs, that differentiate them?
Right. So historically, preterm babies were a lot more risk for bigger, grosser brain injuries, which with the medical advances, we've really been able to reduce a lot of these very sort of harmful, big, obvious injuries that you can see with the naked eye on an MRI scan. But what we still tend to see, not so much differences in brain size, and honestly, a lot of these differences we can detect really with more sophisticated brain imaging methods, are injuries to white matter parts of the brain. So white matter are those myelin structures, the connections of the brain. So what we tend to see differences that suggest that the tissue has been altered in these children, particularly in the white matter areas of the brain, the connections of these brains. The size is generally okay, but what these differences relate to are actually children's later cognitive abilities, including language. So we see a lot of variability. Some of these children look very similar to those of full-term children, but there's other children that have a lot more of these sorts of alterations, which we're not necessarily sure if they are injuries, representative of injuries, or they may be something that's sort of compensatory. So this is something we're still very much trying to investigate and understand what these differences really mean in the white matter, but they're not the same as they are in term-born children.
Okay, and then what are some of the tangible differences that you've seen in studying these children? I know some of them you've been following through after birth and, possibly a few months after they get released from the hospital. Like, are there clear differences that you see with a population of them that are different from full-term babies?
Right. So there's been a lot of research looking into this, not just our group, but, about 40% of children born preterm, and usually those born very preterm, that meaning born less than 32 weeks gestational age, are at much more increased risk for later neurocognitive disabilities in many domains. So executive functioning, language, and other abilities. They're more subtle differences. They're not as, gross as something like a cerebral palsy or an autism. Those are also risk factors of prematurity. But those kind of more severe disabilities that we see in preterm children are less common, but you see a broader amount of those disabilities, what we call more subtle differences at around in about 40% of babies born preterm less than 32 weeks. So what these sort of differences look like when I say there's a difference in executive functioning or language, those sorts of things, we see that these children tend to struggle more academically. So they're behind their peers in terms of reading abilities, writing abilities. Some may have more gross speech production disabilities as well. But there's a spectrum of this as well. So even within those kind of cognitive problems, there's quite a bit of variation. And that's a lot of what we're trying to understand is, what really contributes to the child that is, just slightly below their peer, a full-term peer, versus the kids that are really affected by the premature birth. And there's not a real, we can't put our finger on it quite yet.
Yeah, which is part of the reason, why we exist and what we are hopefully going to help, parents to figure out is we hear stories like, my child is not babbling at 9 months and the child was preterm. So parents aren't sure if this is because they have a preterm baby, how much of it is typical, expected for it preterm, or atypical, like should they start looking to therapies and all that. Curious, like what's your usual response as a researcher, if, for parents that are in that kind of gray zone and don't have necessarily a child who is in school yet to fully have a full picture?
Right. Well, I'm not a clinician, so I don't want to, give any advice that I wouldn't recommend. But I think based on my experience, I'm not a big advocate of the wait and see approach because a child's language is so fundamental to so many of their later skills that I don't think it's harmful to go, if you have concerns, to start early and start investigating those processes, because we know that interventions are more successful at helping children when the earlier we catch them. So if there's at all any sort of hunch that you think there might be a problem, it's worth starting to investigate your options and trying to figure out what's going on as opposed to waiting. Now, recognizing that sometimes, your ability to receive services and these other sorts of things, depending on the country or county or city that you live in, may require a certain score or that sort of thing. But as a parent, you still, I think, have the ability to seek other resources and try to get your child what you think that they might need as best as you possibly can. So that's my general approach toward it, because I think the earlier the better. Also, just thinking from a neurobiological perspective, the younger you are, the more plastic your brain is, the more adaptable and shapeable it is. So if you can get in interventions or just expose them to speech or try to get them practicing these things, I think the more likely success you will have.
One thing I'm really curious to hear from your perspective is what are some of those interventions or stimuli that you guys have been experimenting with, and what have you observed any structural changes to the brain when you expose these children to those stimuli?
Great question. So I have, there are kind of standard clinical procedures for interventions that are available. But what I'm really experimenting right now in my own research is a clinical trial. We're looking to see if by exposing premature babies to recordings of their mother's voice while in the hospital nursery. The reason we're we're doing this is that normally, first of all, if a baby remained in the womb, they would be hearing mother's voice throughout pregnancy from about 24 weeks on until birth. When they're born into the intensive care unit, they're often not exposed to that regular amount of mother speech. If they're in a single patient room or in an incubator, they're really not receiving much speech input whatsoever. There's already many studies showing that babies who experience more speech in the NICU do much better health-wise, so they become much more physiologically stable. But what we really don't know is if this sort of exposure is beneficial for their brain development and also their later language outcomes. So right now we're experimenting to see if we can actually see differences in babies' brains compared to ones that just are having the normal kind of NICU experience to those in which we supplement by playing them these additional recordings. And some of our preliminary evidence suggests that we're actually seeing changes in the baby's white matter. These tracts of the brain that are important for connecting various regions of the brain are actually changing as a result of our therapy or our treatment. So we hope that this is kind of a very, very early intervention that we can just give to babies to already start to boost their brain development. The next stages of this research are to see if we can sustain these effects over time and see improvements in their language development. So that's very much a work in progress right now.
Really interesting. If I were to ask you, like, as a researcher, whether you had any hunch or any other, thoughts in terms of what can structurally change the brain of preterm babies, other than hearing the sound of their mom, what would those be? There's research on music, there's research on others. I'm just curious, like, if you had unlimited resources, what other ways did you want to experiment?
So, I mean, I think, I think there's a lot to be done just in terms of supporting the relationships between mom and baby. So whether that's through speech or just bonding and breastfeeding, I think that's an enormous driver of a lot of babies' health and mother's health. And we know that mother's mental health can very much depend on the baby's health and vice versa. The baby can respond to mother's health. And I think that if there were more interventions to help mom and the family support them through these kind of stressful times, I think that would have enormous strides, because there's a lot of medical interventions that prevent a lot of illnesses and prematurity, but these interventions just aren't preventing the longer term kind of neurocognitive problems that we see in children. And I think a lot of that has to do with kind of more these sort of socio-environmental factors that are very hard to treat medically, right? How do you treat mental illness or poverty? These other sorts of things that I think affect a baby's development very much so. That's, I think treating those and kind of intervening on those factors are also really an important component and larger picture to children's development. I do think music is actually a very interesting and also another tangible intervention as well. I think that somewhat depends on the family and their receptivity. I think some families are highly musical and they're very much interested, and it can also reduce stress in babies. And I think that has its benefits as well. So, but yeah, I'm generally, what I'm kind of interested in is what I call non-medical interventions. So these sort of family-based approaches to supporting the care of infants and involving them more directly in their care during these early stages of development.
And I guess a lot of that probably goes back to the role of nurture and the environment in those first 3 years. As the brain grows and the window of neuroplasticity is there, I don't know if we can quantify it, but is there a way, or is there research in determining how much of it is, nature versus nurture, or genetics versus the environment? Like, how much of the brain can we actually influence with these interventions?
That's a great question. I don't think we really know that. And I think that also lies on a spectrum, right? I mean, I think there are certain genetic conditions that heavily influence the cognitive abilities of a child. That said, an enormous amount of nurture can still change and shape that. It may take a lot, the learning curve may be much stronger and steeper and require that much more input in those sorts of genetic conditions. So I think there's not going to be a set answer on that. But I think we definitely know that the environment can play an enormous role in those first 3 years of life. So, in these very sad scenarios where children are, left, in these very, very kind of deprived situations, we know that can have extraordinarily long-term and lasting effects. But I think if intervened upon early, we can kind of also overcome those sooner and better. So I think it's a great question. I think it's there's not a hard and fast answer to where that kind of lies.
Great, thank you so much. I really enjoyed this. Is there anything you wanted to add, from your research, or I guess as a mom yourself, that you have experienced for the people who are listening?
Yeah, I mean, I think one thing I think I enjoy about a language or a reading is it's kind of this opportunity to engage and bond with your child too. I think you hear about, reading to your baby, and the point and advice when reading to your baby is so that they can get exposure, but it's also, I see it as a great opportunity to cuddle with your child and to have those sorts of moments with your child where you're bonding. It's not about reading 10 books a day and meeting some sort of criteria, right? It's more about having that exposure, engaging them in the process, having a good time with your child. So it's you are teaching and you're being having that experience with your child. So I view it as that's another kind of reason, I guess I'd say, becoming a mom, I've become engaged instead of understanding language too. Is not only do I find it a fascinating behavior in and of itself and an important life skill really, but it's also kind of this really touching way to be involved with your own children.
Yeah, no, for sure. I've also experienced how even receptivity of language from a child's perspective completely changes depending on the quality of delivery. Meaning, like, if my mood and how I'm talking to my son or how I'm reading a book to him completely changes how much of the information he absorbs. And that has also been really interesting to watch. Thank you, Dr. Travis. Really appreciate your time. I'm a very, very, I've been following your research and I'm fascinated by it and will continue to do so. And thank you again.
My pleasure.
For everything you do.
Lots of fun. Take care.
Thanks. Bye.
Okay. Bye.